to inviting Mr. Arnab Kumar from Niti Aayog. He has joined us. He will be talking about the aspects of Arogya Setu app itself, since Niti Aayog is the one which is spearheading it. Mr. Arnab.
Thank you, Dr. Gushan. Thank you very much, everyone, for dialing into this conversation and allowing us all a chance to have an informed conversation on Arogya Setu. When we were developing Arogya Setu, when we started doing this 6 weeks ago, the primary purpose of what we did was to make sure that we buy more time to our frontline health workers. We develop a comprehensive solution backed by technology that can help us understand how the infection is moving, what is the direction and velocity, and whether we can automate some of the processes that are involved right now in terms of tracing who may all have become infected when somebody turns COVID-19 positive. Contact tracing is the central theme, central spirit of the product, which is what we are doing through Bluetooth. What we have also done is that made sure that we take care of all the aspects of the app from a medical perspective. So if you see a self-assessment tool, it's as per the ICMR approved guideline, we have a strong dependency and connect with ICMR. What we have also done is that in our backends are integrated with both ICMR dataset and the NCDC dataset, so that we make sure that there's a real-time communication between the two, and the app starts triggering for contact tracing the moment somebody turns COVID-19 positive. The app works in a very simple way, which is when if two people with the app installed have their Bluetooth on, we take a signature of the two interactions, store it on the device, and only pull this information in case one of us turned COVID-19 positive, in which case we look at the contacts made by this person in the last 14 days. We then calculate the risk of infection. What we do not do is just to create a table of who all they have come in contact with. We go a step further and say, what is going to be the potential risk of infection of this person, having met a COVID-19 positive person, and then we categorize that risk and take appropriate medical action. This could range from testing that person versus putting them in quarantine versus advising them self-isolation. What we have done is, and we have made it very clear that this is not a definitive indication of you turning COVID-19 positive. This is a probability of infection, and hence, if we have to be targeted about our testing protocol, we have to be targeted about how, where, and how hotspots are emerging. That is what we are doing. Two things that we have made absolute care of is that a lot of people are trusting their sensitive information with us. So we do to the best of our ability not to make sure that the data is compromised at any stage. And the second aspect is that the app is so intuitive and easy to use that it's in the hand of every single Indian in the country, which is the manifestation of that is that you will see that the app is currently in 12 languages. We intend to extend this to all 22 scheduled languages of the country. What we also intend to do is that you'll see that most of the information on the app itself is large font graphics rather than small texts. And the second thing is that we have a very sophisticated dashboard at the back end, which is working with doctors, etc., in real time. Basis the self-assessment test that people have filled across the country, we have highlighted a number of people who may be at risk because of various symptoms that we have shown may or may not be related to COVID-19. What we have done is that we have asked Ayushman Bharat, and with a set of army of doctors, we are proactively reaching out to the people who may be at risk for various things. So if somebody has said cough as a symptom, can we reach out to them and say whether they're doing okay or not? They've already started doing it, and our plan is to cover every single one of us in the limited period of time to make sure that everybody is happy, everybody is safe in these difficult times. So this is what we are trying to do: gather information, act on them proactively, design our testing and medical intervention strategy as a country, while making sure that the data is safe. Data is only exposed to people who are directly related to COVID-19 medical intervention. Nobody who is not needed to know about the information can ever have access to this data. That is a promise that we have to the citizens of the country as a design principle for that. Thank you.
Thank you.